Vaheguru Ji Ki Fateh. Today, Sikh Spectrum has come to the London Independent Hospital that you can see behind me, and we're going to interview Dr. Flora, a varicose vein specialist. So, आओ चलिए अंदर उन्हें जाके interview करिए.
I feel very proud to be a Sikh and be in this position, but also it's nice that the Sikh channel has taken the time and made these programs where we can showcase some sort of different angles, if you like, of what Sikh is.
Harpal, nice to meet you.
Likewise, Gurdeep. Welcome.
Thank you. So we've come to your office now. It's a really nice building in this residential area. But before I start, I have to say that I was downstairs talking to the reception, and they obviously think very highly of you. They were already commenting about before the Sikh channel, what was going to come here. That it's Harpal. In fact, they said Paul to me. Oh, you're going to meet Paul. So let me start by asking you that question first. Is it a reason why doctors start to call themselves English names? Or is there a reason that why people don't know that Ranata Harpal?
That's very kind of you, Gurdeep. I actually told them that a big TV channel was coming today, and so you've not disappointed them. In terms of what you say, my name is Harpal. And in fact, from birth, it wasn't me calling myself Paul, it was actually mum and dad. So naturally, friends, relatives have continued with that. And then professionally as well, I'm very much known as Paul. However, what I would say is that it was always one of my ambitions at becoming a consultant that I would make sure on all official documentation that my name was put across as Harpal Singh Flora. And that stands. The problem is, whilst it makes me very happy and proud, other people then, cannot correlate Paul to Harpal, despite the surname being exactly the same. But it's not something that was, I would say, intentional on my part. It's something that has just, happened.
Talk about your upbringing then. So where did you, the schools that you went to, your parents, and for example, your university time? Where was all that spent then?
Okay, in fact, I was born not very far from here, in the Hackney Women's Hospital, which is now shut. And so predominantly I grew up in East London. In a very working class family, both parents from India, and worked hard to really, look after us, support us, and encourage us particularly to strive for a good education. And that was the emphasis. And really the kind of ethos within the house was spending time together, and an atmosphere of love. In terms of my secondary schooling, I went to a school in Woodford Green called Bancroft's, and thereafter I went to the Barts and the Royal London Hospital Medical School, which again is not far from here, and I then ended up as a consultant here, appointed in 2008. The irony of it is that my sister wanted to be a doctor, and I wanted to go into finance, and what's happened is that my sister has become an accountant and I've become a doctor. But the kind of reality was that a careers teacher advised me that I should opt for medicine, and it still would give me the, if you like, flexibility to move into any other profession if I saw fit, because I'd have a strong degree. In terms of want to do medicine, and I'm asked that question many times by particularly youngsters who are applying for medicine now. And I would say, it still remains one of the old established professions. It still commands a lot of respect, trust and confidence from society, which is important when selecting your vocation in life. And clearly it's culturally very much appreciated, but I think one has to look beyond just those kind of very subjective reasons for picking a vocational training, because it's going to be something with you for the rest of your life.
Okay, what about your family life regarding children? And I assume you're married. And how many children do you have?
So I'm married. I'm married to Manaswini, and I have 2 boys, Aryan and Ral, who are 4 and 8 respectively. Both love football, cricket and golf. And I have to say they've added a lot of focus to my life. I also live with my parents, which I think is from my perspective, is a privilege. And I always say to my children, in fact, that actually, they're very lucky to have them around, not just for the cultural awareness, but the love. I met my grandparents actually on my father's side only once, and it's something that I do miss and regretted. And hence I do say to the children, make the most of your grandparents, enjoy them.
That's an interesting point, that culturally we've sort of moving away from living together as a family. I think it's really nice, Harpal, that you've actually managed to keep grandparents there, because you're right, that time can only be spent. It's a short time, I think, with the grandparents, and a lot of children miss out. And if we go down the English cultural way of we all live independently, they sort of become very, very independent. So, what is your dad involved in the local Gurdwara politics or not?
He's not, and that's in part because of his kind of he was recently quite unwell. But my sister's father-in-law is very active in the Gurdwara circle. He, in particular, is the president of the Sikh Forum. And as a consequence of that, there are yearly dinners which are arranged, which are actually charitable dinners, which go towards raising awareness and funds for a school that have been set up in India, built and, as I say, funded by this organisation.
The surgery that you do, and I mean, on your card you've got that you're a general surgeon as well, but exactly what does that mean in terms of, is it a particular surgery that you perform on patients?
General surgery is a historical term, and it's the specialty. It includes a number of types of surgeries. And so what one does is to train as a general surgeon and then sub-specialise further into a couple of areas. So my areas are vascular and endocrine surgery, and in particular I do minimally invasive surgery for those conditions. We
talked about vascular. I mean, usually I think about varicose veins. I mean, is that something that do Asians have issues with varicose veins, or is that a European sort of disease?
Good question, Gurdeep. I think first of all, vascular encompasses arterial disease and venous disease. And there's no question that venous disease is much more predominant than arterial disease. But if I can just touch on arterial disease before I answer the venous side, because it's quite important. As Asians, as Indians, we suffer from the same risk factors for cardiovascular disease as our Caucasian counterparts. In fact, we have higher rates of diabetes, twice as much. That will increase our risk of things like strokes, heart attacks, and indeed death from any other cause. And therefore, if we do present with arterial disease, it is important that we get checked out, so that it may be that we already have heart disease or vascular disease affecting the circulation to the brain, which may result in something fatal. Going back to veins, it is very common. It affects about 30% of the population. It is, you're right, it's very much a condition in the industrialized and Western world, but it probably affects about 20% of Asians. And as we evolve in terms of generations in this country, there's no question we will become as the local Western population.
I mean, the other question I had was about ulcers. I didn't know until I came here about leg ulcers, because I've always assumed ulcers were to do with stomach. So do you perform operations on ulcers that are in the leg?
Yes, so obviously again, ulcers is just a terminology for the loss of the epithelium over the tissue. Now, whether that's in the stomach or whether that's in the leg or any other part of the body, it is of irrelevance. But you're absolutely right. From a vascular interest point of view, it is usually tissue loss in the leg. It's usual to find this as patients become older. However, it is a problem in younger patients, and therefore it can lead to requiring time off work, lots of dressing changes and operations. So it's important to recognise it and be referred to a specialist or group of specialists with an expertise to treat this problem very quickly.
You know, that's what you specialise in. I mean, this particular hospital where we are today, which is the London Independent Hospital. This is not the only place that you actually perform the surgeries. There are other hospitals that you're linked with as well?
Yes, so my NHS base is at St Bart's and the Royal London Hospital, and as a consequence we have a large catchment area, and we take in patients from all across North East London and into deep parts of Essex. But I also have a busy private practice which runs on the east from the Roding Hospital right into central London, where I do the bulk of my work, and particularly complex work around Harley Street, which is the London Clinic and the Princess Grace.
Okay, I mean, the other question I had was about the Gurdwaras. You've probably seen that lots of Gurdwaras have started doing, you know, blood pressure checks with, you know, your cholesterol is high and that sort of stuff. But is there something more that we should be doing, you think, in terms of just doing that sort of top MOT checks?
I think what is important is raising the awareness, okay, that there are these problems. So as I said earlier on, if we have symptoms in the leg, that may well be a marker for a problem in the heart or for a risk of developing a stroke. So educating the community is very important. We still suffer with the same risk factors which can lead to these potentially fatal problems. So whilst an MOT is better than nothing, but increased awareness, whether it's through pamphlets with translated in Punjabi or going into the appropriate forums such as what you're achieving now with this show, we have to get that message out.
Do you think a lot of Sikhs don't actually go to private hospitals because there's a cost factor? Do they think kharcha bahut hai, sato kharch nahi hona and so on, rather than because I don't know whether it's, you know, the cure for it. I mean, will they think the treatment's much better than, for example, doing it privately than on the NHS?
That's a good question, because again, I mean, it's a generation thing, and I think one has to remember that the NHS does serve the general population very well. That is a given, and we must accept that and recognise that. But there's no question, I think, with the next generation, that they may feel that actually trying to get their parents or grandparents seen quicker, getting this problem solved, or certainly diagnosed and then solved, because many times patients are being sent around several specialists without any improvement. But if you can get to a private specialist or a specialist, team of specialists that look after this kind of problem, or indeed any problem, it is worth going down that road.
I mean, people sometimes get concerned about having surgery. They'll be off work, but they'll need you know, depending on your age and so on. So what sort of you know, feel-good factor or comfort factor could you give those people?
What I would say is that, you know, technology and techniques are changing all the time, and particularly with vein problems, we can do it using minimally invasive techniques such as laser or radio frequency, whereby you can literally walk in and walk out after the operation. And actually, I'm about to do a case now, so you're very welcome to join me in theatre so that I can show you how we do this.
Okay, well, that's an offer that we're not going to turn away, so let's go to the surgery and see what Harpal does. So let's go to the surgery then.
Why have you come to see me today?
Problems with my left leg, get some aching and burning. And
have you got any swellings on your leg?
Got some veins that show.
Okay. How long have you had those veins?
Couple of months.
Okay. And when is the aching worse? At the beginning of the day, end of the day?
At the end of the day, after I've been standing for quite a while. And
okay. Is there anybody in the family who's got varicose veins?
Yeah, there is a family history.
Okay, and have you had a deep venous thrombosis before?
Never, no.
Okay, and what work do you do?
I work in a supermarket.
Okay, so you're on your feet most of the day, aren't you? Does it affect you working? Does it stop you from working?
I do have to stop sometimes because it, you know, the aching and the pain and that hurts.
Okay.
Okay, so now we've come to the changing rooms before we go into surgery. So we'll have to change our clothes and put the various clothes that they give you in hospitals. So we're going to have to wear these, and we're going to have to wear one of these on top of our heads, I think. And probably I'll have to wear this around my face, I think, like this. So I'm going to become a surgeon myself for half a day. Okay, so I've got all dressed up now, ready to go into surgery. I'm just waiting for the doctor, and so we'll take the Sikh channel cameras into surgery and into theatres and see how this procedure, this keyhole procedure, is performed. Well, we've come outside now, all scrubbed up and ready to go. So what would be the next step here?
So I'm going to take you into theatre. I'll introduce you to the team. The patient's already on the operating table, and I just need to put on my gown and we can start the procedure. Okay. So let's go. Come.
Right.
Hi, I'm the anaesthetist and I look after the patient. What I try to do is make sure the patient is comfortable from the aspects of pain relief and really just generally not too anxious, because it's quite a stressful situation for the patients to come in for an operation. So what I'm also doing is monitoring the patient's heart rate, blood pressure, and making sure that those are all stable, and to respond to any changes that occur during the procedure. So what we have here is I'm keeping a monitor, monitoring the patient's heart rate, if you can see here. This is the anaesthetic machine, and we are monitoring the heart rate up here, which is satisfactory. The amount of oxygen, here we are monitoring the patient's oxygen levels, and we have the blood pressure here as well. Okay? So this patient at the moment is having a sedation.
Right, okay. So is this the normal sort of procedure before you start on doing what Harpal's doing regarding varicose veins?
Yes, I mean, for this type of procedure, we can do it under sedation. Some procedures do need a general anaesthetic, so that will be more complicated and more involve the use of more anaesthetic drugs. So in this situation, we are using sedation and its suffix for this procedure.
Okay, no, that's good. So we'll just see what happens when we go over. So what are all these other people doing here?
Everybody has a role in theatre. We have the scrub nurse that will be helping Mr. Flora doing the procedure. We have an assistant with me who will respond to any, if there's any problems that occur, can assist me doing the anaesthetic. And then we also have what we call a runner, who generally will run around with any bits of equipment that is required during theatre. And the number of theatre staff depends on the complexity of the surgical procedure. So the greater the complexity, the greater the number of staff in theatre.
Right, right. Interesting. Okay, let's just wait for him then. Is he? I assume Harpal's going to get scrubbed down?
Absolutely. So at the moment, in terms of infection risk, Mr. Flora is scrubbing, and I don't wish to see how he scrubs down, to reduce the risk of infection.
so we've just come out of the theatre. So Harpal, was that a successful operation that you've just done now?
Yeah, very much so, Gurdeep. As you see, that probably was about 20 minutes, and we've heated the vein and taken away the external veins. So from my point of view, certainly that will be successful. It will improve her symptoms. I think she'll be happy with the cosmetic result, and certainly I think in terms of complications, future skin changes, that will certainly prevent those.
Okay, my last question, Harpal, is about your aspirations. Is this where you think it will stop for you, or are you looking to, go further places in your own career?
Yeah, I think that's always a difficult question. I think that personally, there'll always be professional, leadership and strategic roles to take on. So, leadership within the department. Beyond that, with kind of national screening and other programs. But I have to say that, what's important is when you look forward, is to actually look back. Where have we come from? And I'm here today because of a strong family, a very supportive and proud community, who really, are characterized by ambition, determination, and honesty. And, I've been inspired by many, many individuals, and some of whom are not with us today. For example, my wife's father-in-law, my wife's grandfather, Mahinder Singh Joshi, was the judge, chief judge, in fact, of the Delhi High Court when Indira Gandhi was trialled. My father-in-law recently was lecturing in front of the Indian Parliament about organ donation. And we have many other iconic figures here. Judge Mota Singh, Fauja Singh Ji. So many, and there are many other professionals behind that as well. And I suppose what I see and my aspiration is not just for me personally, but an aspiration for our community. And so it's incumbent on me, a responsibility for me and my generation, to give the confidence and a platform for the next generation to take our community forward. And I suppose that's where it lies. I think if the community is strong, as an individual, I'll be strong.
Actually, I think that ends very nicely because I think, Harpal, you're a great role model, by the way. I think, personally. Sanu eddan de sikhane vich role model chahiye. And with that, I want to thank him for being on the Sikh spectrum with me and, wish him all the best in the future. So with that, Harpal, let's do Fateh. Vaheguru Ji Ka Khalsa, Vaheguru Ji Ki Fateh.